What's the age group for women that come in and talk and have this kind of vein disorder?
Well, like I said, I think it can be any age group. I've seen bad veins as young as 25, and I've seen spider veins as young as teenage. I mean, kids, in high school, sometimes you see them. Most people will start seeking help, and it just depends on how bad it is. But most people will start seeking help somewhere probably in their 30s, 40s, somewhere in that area.
And you mentioned the husbands taking their wives to the mall. Does this happen in men?
Yes, not as it probably happens equally in men. I think that one of the reasons why it begins a little bit earlier in women is because of pregnancy issues, and because when women get pregnant, of course their uterus gets large, and that picture that you saw before, where that big vein's going up through the groin, that eventually goes through the pelvis, which gets compressed by an expanding uterus. And if you look at a uterus that's carrying a 9-month-old fetus, it's pretty sizable. And if you stand up walking at all, it wants to go down too, and it pushes on those iliac veins, the big veins, which has a tendency to accelerate the problem a little bit quicker in women. And so I think you see it more in women. Of course, women shave their legs. Most women shave their legs. Guys usually don't. So we got hair all over, and you can't see them as much either. So that has something to do with it. My guess is that if in reality, if you were to take all comers, if you took 100 guys and 100 girls, the same age group, and you studied them all, my guess would be that you'd probably have a pretty equal incidence. But we can only study the people that come to see us, and I think women have a tendency to come more often than men, but it does occur a lot in men.
How about insurance? Does insurance cover this?
Insurance is, it does if there's symptoms. If you come in and you have pain in your leg swelling, skin changes, or any of those kind of things, then that we can work it up and see what the problem is. And in most cases, insurance will pay for it. Now, most modern insurances they have what I call a stocking requirement, and the stocking requirement is the insurance companies will require you to wear a specific millimeter mercury compression stocking. And
we're talking about one of those thick compression stockings that helps hold everything in.
Right. I mean, they have some models and manufacturers that are making them a little.
So even those have improved.
Yeah, they're a little cooler now. You can get them in different colors and stuff like that. So it's not the old skin tone alligator scale looking things.
Nice.
Although, we do give them to some people. But once we put you in the stocking, if you wear the stocking, and those stockings are not going to cure the problem. That's not. They are there. They're for symptomatic relief only. And what we do is if your insurance has a 3-month stocking requirement, then we give you a prescription for the stocking, and you wear it for 3 months. And then if you meet all their requirements, they will generally pay for the laser treatments of the saphenous vein, the greater saphenous, the small saphenous. They generally do not pay for sclerotherapy. Sclerotherapy they consider a more cosmetic procedure, but it depends on how bad it is. Most time, if we get the veins closed, you can sclerose the veins without any problem, and they stay gone. If you don't close the vein, and it's a pressure issue, they come right back.
Now, when you're closing the veins, are you in essence removing it from operation in the body?
That's correct.
Now, I can't help but wonder, if you're shutting it down, don't we need these veins? What happens when you start getting rid of them?
Right. Well, and that's a viable concern for most people. What you have to realize is, and there are a lot of other reasons why people are concerned about taking these veins out. That a lot of people use them for coronary artery bypass grafts. They use them for bypass grafts in legs and all kinds of different things. And the thing that you have to realize is that they're not working anyway. They're not doing what they're supposed to do. They're creating more problems. And secondly, a vein that's dilated and going all over the world is no good for for bypass grafting or anything else because it's defective. And so you're eliminating a part that's really not functionless. It's only functioning to create problems.
And your other healthy veins are going to take over and be much more efficient.
They'll actually work better.
Okay, great. Well, we talked a little bit about some of the age limits and the age range of some of your patients, and you talked about some of the younger ones. If somebody has spider veins, should they come in when they have the spider veins? Is that a precursor to having a varicose vein problem? Should they catch it early?
Most of the time, it is a precursor. Almost all those people, if you talk to them, there are hereditary issues going on there. They may not have it yet, though. I mean, like I said, it's a chronic, progressive disease that starts, probably when you're born, and it takes a long time for those vessels to start dilating. And the way they start usually are with little spider veins. The saphenous vein's not flowing right. The connecting vein between the saphenous vein and the vein in the skin, which is called a reticular vein, starts swelling up, getting larger, and eventually that's reflected in those little veins that you generally don't see in the skin as spider veins.
I think we might have a slide that shows some of the various stages.
Yeah, I think we do.
About where the veins begin. Tell us what we're looking at here. Now, are those spider veins?
That's what most people would call a spider vein. And this is one that's probably a little worse than some, but not as bad as others. It's kind of an in-between in severity. And this, and I think I have a slide, we have a slide here in just a little bit that kind of shows a reticular vein. But if you look at in this slide, let's go back to the other one. If you look at that slide, where it almost looks like a comet with the smoke trailing behind it. Well, if you look at the ball of the comet, the most purple spot,
so it looks kind of like bruising there.
Right. If you shine I have a little vein light that we use. If you put a vein light on that, what you'll see is there's a reticular vein coming from the saphenous right up to that spot, and so this is a reflection of a bigger issue, but that's what you would call a spider vein.
And what are we seeing here?
What that is, that's pretty much a full-blown varicosity, and that is not the saphenous vein. What that is that's usually what used to be some type of a branch off of the saphenous vein that the pressure has over time enlarged and caused to become very, very tortuous. Now, when we close the saphenous vein in reticular, or we use sclerotherapy to treat spider veins. For these types of veins, we use what's called a phlebectomy, where we make little bitty tiny incisions along this vein, and when I say tiny, I'm talking about a couple millimeters, 2 to 3 millimeters, which is about 1/8 of an inch, and we have little tools that we can go in there. We actually try to take that vein out, because if you leave that vein in over time, when there's no more flow going through it, it will eventually clot, and it can cause hyperpigment. It causes skin to change colors, and we don't want that to happen.
After somebody's been through vein treatment, such as you've been describing to us, what kind of change do you see in their self-esteem?
Well, they can wear the clothes they want to most of the time. These are, like I said, it's a chronic problem. A lot of times it takes more than, you kind of have to treat it in stages a little bit. Usually we take the vein out of the system initially with the laser. Then we come back and we do the phlebectomies if there are some to do. Sometimes you can do them at the same time, it just depends. And then what we do is, after all of those problems are taken care of, then we do the sclerotherapy. And after we do the sclerotherapy, I mean, you can pretty much make legs almost approach normal, or normal appearance.
Okay. I think we have a few more pictures here that we can look at. Now, tell us what we're seeing there.
Well, what you're seeing here is pretty amazing, and a lot of people argue that this isn't the same person, but it is. And the one on the left is pre-treatment. That's someone that came in that didn't like the way their legs looked, was starting to have problems with pain, aching, and hurting at night. You know, up during the day trying to do normal activities, lay down at night, can't sleep because their legs are aching.
And then the one on the right looks.
The one on the right is after closure of the saphenous system with a laser, and then going in and doing those little phlebectomies. And as you can see on the right, you can't see any major scarring or anything. I mean, if you were to get with a magnifying glass and look, you'd be able to find, you know, 1/8-inch little puncture spots, but you can barely see them. And after about 6 months, you can't see them at all, hardly.
Are there some conditions that are more extreme, like that one?
Yeah.
What is that?
Well, this is kind of end stage, and what you see here is if these problems go untreated, what happens is that the pressure increases to the point where there's blood. You know, blood it gets into the skin. It starts turning the skin brown. Those are iron breakdown products that get in there, and over time, the skin becomes sclerosed. It becomes basically scar tissue. And what can happen is the scar tissue gets irritated, the iron's deposited in there, it starts itching, you get what we call venous stasis dermatitis, and when that occurs, you start scratching enough, you break the skin down, you can get venous stasis ulcers.
So once you treat that ulcer, it doesn't come back?
Well, if you just treat the ulcer, it will come back.
But with the vein treatment, that will take care of it?
Exactly.
Okay. And then the spider veins, when you use that laser light, I think we have a picture of that also.
Well, yeah, we can go to that picture if we have it. That's not a laser light. That's called a vein light.
Oh, okay.
And what that does is that allows me to see. Well, here's another picture of some really bad varicosities.
Yeah, now that looks like rope underneath the skin.
It does. And once that vein's closed, there's the vein.
That's the light I was talking about.
Yeah, and that's just a real bright, cool light. And on the right, in the syringe, is the sclerotherapy foam that we use, and you can see that little dark line going up there that's shown in the vein, and that's the little reticular connecting vein that goes to the.
Well, it's obvious that there have been so many advancements in the treatment of varicose veins and all the other associated issues that go with that, and your practice can provide all sorts of treatment and help for those people, can't they?
Right. We pretty much we've got the newest technology and all that.
All right. And when people come to you, what's the first thing they should ask you?
When can I book?
That sounds great. Well, thank you so much for being with us today. For more information about varicose vein treatment or any other cosmetic procedures, please check out the website at faceandbody.net.
Thank you for watching Beauty Matters. To learn more about varicose veins and other cosmetic treatments and procedures, visit us online at www.faceandbody.net or give us a call at 918-298-8080.